Hello and welcome to The Big Picture. I am Tina Jha. The Finance Ministry has proposed for holding 24/7 vaccination against COVID-19 in the country for the next few months so as to quicken the vaccination coverage, thereby regaining the country's economic growth momentum. In its monthly economic report released on Wednesday, the ministry said vaccinating 70 crore adults with at least the first dose by September will be crucial to achieving herd immunity that could boost consumer and producer confidence and reinvigorate the engines of economic growth. Now, this means with around 4 months left till the 30th of September, India will have to carry out 93 lakh vaccinations per day to achieve herd immunity. The peak daily vaccination rate attained till date is a little over 4 lakh, although that was achieved using one shift of 8 to 9 hours of vaccination. And the proposal now is to make it 24/7 and target more than 90 lakh inoculations a day from now. So how achievable is this target? How are we going to further ramp up our vaccination drive against COVID, aiming for what the Finance Ministry talks about, a herd immunity that could lead to faster economic recovery? These are some of the aspects that we will analyze with a distinguished panel today. I'm joined on the program by Mr. Ajay Shankar, former Secretary, DIPP, Ministry of Commerce and Industry, Government of India, and Ms. Urvashi Prasad, she's Public Policy Specialist at Niti Aayog. Thank you to both my guests for joining me on the program today. Mr. Shankar, allow me to begin the program today with you. In fact, your first thoughts on this economic monthly report of the Finance Ministry. Does it imply that vaccine, given the current situation, is the best stimulus and vaccination expansion, ramping up the vaccination ongoing drive is key to economic revival?
That's broadly correct, because if you go back a few months to, say, February, the expectation was that the Indian economy would grow somewhere between 11-12% in this financial year. The numbers varied, but the numbers were very positive, whether it was IMF, the World Bank, our own analysts, our government. And economic activity was gaining momentum. And then we were suddenly hit by the second wave, and so there have been extensive lockdowns across India, of course localized, but still very extensive. And of course, there's a lot of human suffering in the last many weeks. So the way forward, both from the health point of view, as well as from the point of view of the economy, is earliest possible vaccination of the entire population. If you look at the two countries which have done a good job so far in vaccination are the USA and the UK. They also had many cases of hospitalization, 2 waves, many deaths. But now economic activity is returning and confidence is returning because they are feeling that they can vaccinate their entire population in the coming month or two. And they are now actually grappling with the problem of persuading those who are not coming forward to get vaccinated to take the vaccine shot. So for us, I think there is a convergence of both objectives, health objectives as well as economic activity, that we immunize as large a section of our population as soon as possible, and the full goal should be 100% vaccination of the entire population, and that is the government's objectives. So I think the Finance Ministry's report has got it right.
Absolutely.
Now, there can be a lot of discussion on the date and feasibility and challenges, but broadly, if the economy is to go back on a normal full steam, I'm not saying even accelerated growth rates, then full vaccination and return of confidence in individuals about being able to go out, work, meet people, go in the market, that confidence must come back.
Certainly. So we'll discuss all those aspects in the course of the program, and I'll come back to you. But let me bring in Ms. Urvashi Prasad at this point in time. So when we talk about the, ramping up the pace of the vaccination, given the current pace, what the Finance Ministry is suggesting that we need to take it up to 93 lakh vaccinations per day. At the moment, it's somewhere around 4 lakh, a little over 4 lakh. That's the peak that we have achieved in one single shift of vaccinations. So if we are to ramp up the vaccination and ensure that it's as fast as the Finance Ministry is suggesting, what are the kind of efforts that we have to make in terms of procurement, in terms of seamless supply to the states, and all the challenges that we have been facing all this while in the first 5-6 months of vaccination drive since January?
Yes, so I think on procurement, of course, the center, as you would know, has recently announced that they would be, taking charge of most of the procurement for 18 plus population as well. And of course, working with states to iron out exactly how this would work, but this would certainly reduce a lot of the procurement burden on states that would otherwise have existed. So this, of course, is a move that should help to accelerate things a little bit. On the manufacturing side, also there are several efforts going on to boost the number of doses that are available. We're looking at different vaccines as well. Just recently, the center has placed an order for 300 million doses for biological vaccine being developed by Biological E, which is in phase 3 and which has shown promising results. So, of course, those efforts are very much on an accelerated pace. But what we will equally need to work out are the distribution aspects, which is where we've also faced a lot of challenges, because the second wave, as we've all seen, has also hit our villages, our rural hinterlands in a big way.
Yes.
And so it's not all about, people who have access to the app and, can come to a center and get vaccinated. I think more and more it's becoming clear that we'll also need to take the vaccines to a lot of people. We are seeing some good models emerging from civil society, from others. We've seen a village in Jammu and Kashmir which managed to get its entire population vaccinated because they took the health workers there. So we'll need to expand some of these models as well and make sure that we are not just getting people to the centers, but in some cases, or in many cases, in fact, we might have to take the vaccines to people, and that will have to be done obviously in partnership with private sector, with civil society, because government alone would not be able to manage all of that. So I think in addition to the procurement and manufacturing, we'll need to focus on a big way in the distribution aspects, especially if we want to cover our rural, remote, tribal populations as well.
Okay, so a lot of efforts are obviously underway by the central government, as Urvashi Prasad pointed out. But looking at the current pace, Urvashi, and wrapping up to nearly 1 crore inoculations per day from now on till the end of September, how ambitious is the target? That, of course, looks ambitious, but how achievable does it look at the moment?
Well, it's undoubtedly ambitious. I think there's absolutely no doubt in that. But given that, there's really little other choice that we have, whether it's in terms of tackling the pandemic, whether it's in terms of getting a possible third wave under control, should we see one, or whether it's in terms of really, getting the economy back to some sort of a reasonable level, as Mr. Shankar pointed out, vaccination is really one of the biggest weapons that we have. So it is ambitious, no doubt. The rate has been far slower, as you pointed out as well, till now. But we are hopeful that with some of these accelerated steps, especially with the procurement getting addressed, with other types of vaccines coming in, and states really being able to focus on the distribution aspects, we should be able to increase this rate significantly. So that is, I think, the hope that we have at this point.
Okay, Mr. Shankar. So things at the moment are looking good. The states are now slowly unlocking after this devastating second wave, which was much more severe in terms of speed, in terms of scale. Now the states have slowly begun to unlock, and even the economic activity has begun to gain momentum. How hopeful are you that the economic impact of the second wave can be restricted to just the first quarter of this financial year?
This would depend on a few factors. One of them is that after the number of cases and deaths start declining, and they are declining rapidly, how confident do people start feeling again, those who are not vaccinated? Because last year we saw that confidence came back very quickly. So that's one factor. The second is how quickly we are able to ramp up the vaccination rate. Because if enough people are vaccinated, then obviously the immunity is there. And the third completely uncertain factor is there going to be a third wave? If so, when and with what severity? Would it be mild? Would it be as severe as the second wave? Nobody knows. So there are many uncertainties. But given all those uncertainties, there is no, I think, lack of clarity on what needs to be done, which is vaccinate as many people as quickly as is physically possible, get people to get more confidence and have a greater capacity at the local level to react to some surge in cases and to react efficiently and intelligently so that the problem doesn't spread and it doesn't become an all India kind of rollback of the economic momentum that we hope to get. But one positive thing would be going forward that certainly, as we saw after the last experience of the first wave, that people after this lockdown or closure, etc., do want to go out, do want to spend, do want to produce, and especially those who are on the production side, do want to produce and sell. And those who work for them would certainly like to, it's those who are on casual kind of relationships, either in the supply chain or as casual labor. For them, it's an economic necessity to get back to work, get their incomes back, and get the economy back on track.
Okay, Urvashi Prasad, but although it's an ambitious target, but we're all hopeful because this looks like the best stimulus both for our economy and also in terms of the health of the general public. We must contain the pandemic, and vaccination looks like the best stimulus, of course. But given the ambitious target, the kind of efforts that are being made, there are, of course, multiple challenges that we are still facing. There is vaccine wastage. In some states, it's as high as 30%. And there is also vaccine hesitancy, which is being reported from a large number of states as well, particularly the rural hinterland. Every now and then we come up with these new stories from these areas where the people tend to believe on misinformation. So how are we going to address that? Because the faster the vaccination, the lesser the damage in terms of a possible third wave and in terms of also containing the damage of the second wave. So this has to be done at the earliest.
Yes, so I think wastage is something that we've taken up several times with the states repeatedly. In fact, that's a very important aspect that we always, the center always brings up in the discussions with states. In fact, even the formula that had been calculated on how the vaccines would be allocated had actually factored in wastage, and there was sort of a disincentive to have that wastage. So definitely, I think that is a very big priority, and states are also taking efforts, but we constantly try to identify the states where the wastage is on the significantly higher side and flag that so that that can be addressed on an ongoing basis, because obviously vaccines are very precious right now, especially, and we definitely don't have scope for that kind of wastage. Sure. On the hesitancy part, yes, I think that is where we are in a very big way trying to involve the civil society, the local community-based groups, the self-help groups. Niti Aayog, in fact, itself has been trying to reach out to a lot of these organizations which work in rural areas and tribal areas. They cover the length and breadth of the country. Because it's not just about cities, it's now we need to make sure this vaccine is reaching our rural areas and is achieving that critical mass of vaccination in those areas. So I think that is something where a partnership with community-based organizations, with civil society is imperative, because the government alone, no matter how much, tries to take its message everywhere, it's not going to be as effective as it will be if the messages are amplified in partnership with all these different kinds of groups. So that's the approach we are trying to take. We are also trying to have a more localized understanding of what is the hesitancy, because the hesitancy is playing out in different ways in different areas. Not everyone is hesitant for the same reasons. People have their own reasons. It's local, it's cultural, it's social. There are so many different reasons. So we're also trying to have more localized plans in place to address this, because obviously a one-size-fits-all approach will not work for a country like India. So we are trying to tailor down these plans to the local level, to the district level, to say wherever there is hesitancy, we try and really identify the reasons and then address it very much in partnership with communities, because we don't want to just tell people that, this is what you should do, it's good for you. We want to do it in partnership where people themselves realize that this is absolutely critical and it's a felt need for them. So that is, I think, the approach we are taking on the hesitancy issue, and that is going to be an ongoing one. We're going to have to continually address it as much as we try and, work on the supply side.
Okay. In fact, there have been suggestions from experts that in order to reduce vaccine wastage, there should be a policy of a walk-in or an on-spot registration so that whoever walks in or comes in, no matter which age group, should be vaccinated. In that way, the vaccine wastage can be addressed. Is that something that is also under consideration?
Yes, I think, walk-ins was something that the government always had in mind as a preference. Now, of course, because we were facing shortages in certain areas, many state governments said, don't come in unless you have a registration which is confirmed, because otherwise you can have crowding and overcrowding at vaccination centers, and they can actually end up becoming super spreaders, and people then have to return without the vaccine. So unfortunately, we were balancing that aspect, which is why walk-ins had to be stopped in a number of areas. But as the supply ramps up, I think most of the places will go for walk-ins. In fact, even in Delhi now, initially for 18 plus, registration on CoWIN, prior registration was mandatory. Now in many areas, in fact, they have opened up walk-ins for 18 plus as well. So I think we will go in that direction, definitely. The only reason why it was not happening everywhere was because there was to some extent these shortages, and the states did not want that people land up at a center and then find that the vaccine is not available.
Okay, fair enough. We're hopeful that in the times to come, when we are, also facing a shortage, but up against such a huge population who we have to vaccinate in such a short period of time, all these suggestions will be kept in mind. Coming back to you, Mr. Shankar, and talking about how, of course, we've been speaking about how vaccination is the need of the hour. It is going to boost consumer confidence. But what we have seen in the second wave, even though because of localized lockdowns, the impact, the experts are saying, on the economy is quite muted. But the consumer sentiment this time has been very, very badly hit. So apart from obviously encouraging and ramping up vaccination, what more needs to be done to uplift the depressed consumer sentiment?
Before I answer your question, a small point on the vaccination hesitancy issue itself.
Yes, please.
I think we are underestimating the power of digital communication and social media today. And we are underestimating the efficacy of communication in regional languages. And we have, fortunately, a very good network in the public health system, also level worker, and if we involve Gram Pradhans and political leaders also across parties, because it's a national problem, I think the vaccine hesitancy could be overcome much faster. But it is very real. It is there in the United States. So we have to see that this will be one major challenge in addition to logistics and supply and production. But I also believe that the country has the capacity to ramp up actual vaccination quite rapidly. I mean, the capacities in the country have gone up tremendously. Coming to the economy, I think we would need, and we do need, a demand stimulus driven by government and intelligent government expenditure, so that a certain positive mood enters the economy, because today's mood is not positive. So the government is the only one which can create that mood by actually creating a demand stimulus. And it can be done in many ways. Some of those are already in the pipeline, as they say, through budgetary announcements till now. But I'll just refer to two or three to drive home what could be done. So one is that the announcement has already made that we'll have a development financial institution. We have a pipeline of infrastructure projects over 100 lakh crores. So the best thing to do is to pick up those projects where contracts can be awarded in 3 to 6 months and credit can be provided. Because the moment, contracts are out for construction or for buildings or roads or, power charging infrastructure in cities for electric vehicles, once that starts happening, there is a buzz and there is expectancy. And that buzz and expectancy can, under the current circumstances, only created by government. Government has enough, preparatory work already with it in the last year and a half. So it's a question of prioritizing and rolling out things very quickly. For instance, one of the things which the FM had announced in one of budget speeches was that we'll have a feed-in tariff for buying solar power from villages so that farmers could get higher income. Now, you announced that feed-in tariff today, the private investment will start surging in a few months. So I think there is a very strong case for looking at what is already in government files and in preparatory work done over the last 2 years, choosing where demand can be created very quickly, spread across the country so that market sentiment rises. And construction industry has the maximum multiplier effect. So wherever we can get construction projects out, whether it is expressways or affordable housing in cities or anything else across India, or even just constructing hospital beds across the country, because we certainly are very, very short of hospital bed capacity. In some districts, it's woefully inadequate. So a large national program, just getting construction of beds going, because it'll take time. In the meantime, these doctors can be recruited and the equipment could be purchased. So a big bang demand stimulus, very carefully thought through, calibrated, where contracts go out in the market in the next 3 to 6 months, I think would give us the V-shaped recovery we were hoping to get.
Okay. So Urvashi, coming back to you for one final question. Of course, what's important is that ramping up the pace and also the spread of the vaccination on a war footing is the need of the hour. That is what the country demands. And that's what has been suggested by the Finance Ministry, and for which the ministry has also suggested use of technology to ease the administration of the vaccine, also increased shifts at vaccination centers and integration of mass vaccination sites, for which it suggests shopping areas, drive-ins, schools and primary healthcare centers, which it says will enhance faster coverage under vaccination. So all of these options, have they already been explored under the ongoing drive, or will they be looked at in the coming months when we are talking about ramping up or spreading the vaccination coverage?
Yeah, I think to some extent, they have been explored in different ways by the center and the states. Technology, for instance, we know is already being used, at least for the registration, the back end, storage of the vaccine certificates, all of that. But technology can be used in so many other ways too, and that is something that we can still explore going forward, that how well can we use it, whether it is, the digital technologies, how do we use the digital platforms.
But are there limitations that will have to be eased in the coming months?
I think technology, it's an enabler. So technology by itself can never be the solution for any big public health program. And I think that is something which is important to understand. But as an enabler, whichever aspect of vaccination it can ease up, that is certainly being explored, and whichever aspect it can help to amplify the messages, as I said, reach out to more people. That is something that, again, technology can be used for in a bigger way. The fact that the sites should be decentralized, I think that is already being done in many places. In Delhi, we are seeing vaccinations happening in schools. In a lot of places, it's very, very well organized. And also the risk, of transmission is actually lower because you're not doing it at a health center or at a hospital. Also, a lot of offices, corporates are now coming forward and tying up with private hospitals, etc., to bring vaccination to their employees. There are resident welfare associations which are now trying to organize camps for residents in their areas. So I think a lot of these measures have started, to see effect, and they've started to be implemented. But the potential is, of course, huge. There is so much more that we could do, and there are so many ways in which we could use it. And I think that is what the report is alluding to, that we need to do more of what we've already been doing, but we also need to bring in other types of models, other types of innovations, which can really help to accelerate the whole process.
Absolutely. And keep in mind the lessons that we have learned through these 6 months of our ongoing vaccination drive, ensure that the challenges are addressed effectively. And of course, when we ensure herd immunity, that is by vaccinating at least 70 to 80% of our adult population by September end, which the Finance Ministry proposes, the herd immunity will also help our economy to revive at a much, much faster rate, and which will also, of course, be good for our people, for the country at large. With that, I'll have to call it a wrap on this edition of The Big Picture. Thank you once again to both my guests for joining me on the program today and sharing your thoughts with us on the subject. Pleasure having you on the show. So that's it from us on the program. Thank you very much for your time.